was about the innovation that was available at the hospital, the ability to be able to do things that were innovative and supported. We created the second clinical risk management unit in Australia. There's a big emphasis on quality and safety. As I said previously, the patients are not anonymous, the staff are not anonymous. Supported to be able to employ nursing staff to be the head of that risk management unit, and we could look at adverse events and pull them apart and take action to prevent them recurring. I've been blessed with two clinical risk managers who stayed a long time, Joe Burke, who was the first clinical risk manager, and then Sally Taylor, so both very competent intensive care nurses, and it's just been brilliant. On the medical side, in reviewing medical records, we've done that since 1989, and three people, Ian Campbell, David Leembruggen and myself, started in that on day one, and we're still there 30 years later doing the same things. So no one in the country's got that sort of track record in being able to continuously improve quality. And that's the sort of thing that we've been able to do in a number of areas. Look, it's tough. The recruitment side's very difficult. The funding side's difficult at times. The fact that we're 300 kilometres from Melbourne creates problems with patient transport. The number of small towns in the region who've struggled to recruit and only been able, well, not only, but have required recruiting international medical graduates, which is a challenge because often they've not worked in rural areas, or they're not familiar with the Australian healthcare system. So that's been challenging. But by and large, we've been continuously accredited with the Australian Council of Healthcare Standards since 1974. So I didn't want to drop that ball and be the medical director who was responsible for accreditation and the medical side of accreditation. And this was the first time in 30 plus years that we didn't get it. So there's a lot of ownership here and pride in what goes on. Whereas in the larger hospitals, I think people are anonymous, a lot more anonymous than here. Well, I don't think they are anonymous here, and it's very, very different. Very, very different. Look, they do plenty of amazing things too, at a level that we don't in terms of the technology they have. But I'm not sure that the people there feel part of a community. I don't know. It's been so many years since I've worked in one of those large hospitals. Yeah, well, we've recruited some very good specialists. We've had to go overseas to recruit those. I think we've got some very committed staff here, very, very committed staff. I do feel that will be ongoing, and I think that the culture is very much one of improving quality and safety, providing what's appropriate for a hospital of this size to provide. Yes, it's the quality and safety program that we've expanded, and we modified a program that has been developed in the United States, but the way they do it is incredibly expensive, with having nurses review records on the ward. Ours was a more limited program, but involved the medical records people screening records and then sending them for medical review, and that's been the most rewarding thing. Although, look, I think when I say the most rewarding, I think the most rewarding thing is the interaction with people, with committed people. The thing I've liked the most is we're able to sit down with people in a cooperative environment and talk about how we can improve care. We'll see something in a journal or hear that another hospital's doing X, Y, Z, and we can sit down and think, well, could we do that? And 9 times out of 10, the answer's yes. And I get a lot of fulfilment out of that. I'm passionate about quality and safety, and But there are other areas as well. The expanding of the number of junior doctors. I'm very keen to that they have good job satisfaction and they find that the jobs are rewarding and in terms of their developing their knowledge and skills, but that they enjoy themselves here too, so that their opinion of the place is positive. They'll go back and tell their colleagues that, and hopefully that will we'll have junior doctors wanting to come here for the quality of the care that they can provide and the teaching and the development that they'll get while they're here. Oh, it needs to be someone that's very committed. You're really, well, I was on call for 24/7. Look, I wasn't inundated with calls, but you've got to support the nursing staff that are on when things are not going well, and support the junior medical staff when they're getting out of their depth or they're not being adequately supported. And I would say to the junior staff, look, if at any stage you think patient care is being compromised or you're not being adequately supported, give me a call. And all the junior staff have my mobile phone number and I would respond. If you're really serious about quality and safety, then you have to do that sort of thing. It's not a 9-to-5 job. And it's rewarding because you can see things that are where things have been improved and things that can be taken up to the next level in terms of what can be provided for patients, and I find that extremely rewarding. Al mentioned before about not having, being told you couldn't have a CT scanner because it costs so much money. Well, I've seen how all that's developed and how we do have it now, and someone comes in with a stroke, we're linked up to the stroke service. The technology allows that CT scan to be interpreted by a neurologist within about 20 or 30 minutes. Well, we're 300 kilometres from Melbourne, and someone walks in, or brought in by ambulance with query a stroke, they can find out definitively what has happened and get definitive treatment in a hospital 300 kilometres from a capital city. Well, that's mind-blowing, really. The technology is part of the reason we can do that, but the commitment of the staff is another reason. And in many ways, someone will get a CT scan that for query stroke faster here than they will in some of the larger hospitals, because there isn't the complexity, the number of people you've got to go through. It's just straight into the CT scanner and off we go.